Thank you, everyone, for joining us today. I'm Heather Gatney, and I am the host of the CVFS webinar series. Our host today is Bill Axon, research professor at the Population Studies Center and the Survey Research Center at the University of Michigan. Bill is going to present on the CVFS's new young adult panel study. There will be a Q&A session after the presentation. We ask that you remain muted until then. During the Q&A, you may raise your hand to ask a question, or you can submit a question at any time today using the chat feature. We'd also like to inform you that this webinar is being recorded and will be available to view from the CVFS website, and we'll also post Bill's slides there. So it's all yours, Bill.
Thank you, Heather. I'm working on getting the slides, which I just accidentally closed back up for everybody. And while I do that, I will comment that portions of our presentation today actually overlap with a presentation we gave in 2022. And because of that, I'll note that various places. Oh, I see the problem. Let's see if we can make this work. And I will go fast over those places that repeat. I wanted them to repeat so anybody who's seeing it for the first time or accessing the slideshow could see that information if they wanted to. So we're going to talk about the new CVFS Young Adult Longitudinal Study focused on sex, contraception, and substance use. Bunch of people helped make this possible. Stephanie Chardul, Heather Gadney, Carl Dinkelman, Jenny Williams all contributed stuff that I'm gonna talk about today. We're gonna talk in 4 big collections: the scientific objectives, over which I will be brisk, study design and data collection, our baseline findings, or at least enough to tease you into being interested, and our longitudinal follow-up findings, again, a small amount to tease you into being interested. The scientific objectives are somewhat, somewhat broad. We wanted to provide young adults with a private, confidential method for reporting potentially sensitive topics. I'll focus on a bunch of those today. We also wanted to measures that assess events that we know are changing rapidly during young adulthood. And finally, we wanted to follow these same young people to repeat measures as they leave their parental home, travel for school, work, or marriage. And as many of you know, a lot of young adult travel in Nepal is international labor migration, which adds to the complexity. This is just a picture of Chitwan to frame the discussion. And I'll switch into talking about the study design first. The study design overview I'm going to give you was presented in 2022 in February. So a couple years later, I'm just going over it briskly to make sure everybody's got a clear understanding, or at least a starting point understanding of the sample recruitment process, the human subjects protections, the contact protocol, and the instrument design. The sample recruitment focused on those who were aged 15 to 25, included parental consent for those 15 to 17, included a birth date verification because, as those of you who've used our household registry know, there is age heaping there, and also an age-appropriate informed consent. The human subjects protections are an important part of what we want everybody to know about. It's one of the reasons I've reported them here. They include steps for recruitment of subjects, for informed consent, for privacy screeners at each interview, and for saving responses directly to the University of Michigan secure servers to keep their answers completely confidential. For minors, we have a parent or guardian contacted before contacting the minor subjects. Staff member explains the study to a parent, obtains permission. for the child's participation. For everyone, we then invite them to participate via email, or if no email, by an advance letter to the respondent's home. We did no in-person recruitment. Informed consent assent included invitations to recruit all those 15 to 25 years older, included a description of the study and a link to the baseline web survey, and either comprehensive written or a more simple assent were obtained prior to starting the survey. For telephone surveys, interviewers read the entire consent assent form to the respondent and addressed any of the respondent's questions. Baseline interview began after the consent or assent was obtained, and a waiver of documentation of consent or assent was obtained. And by waiver of documentation, I mean lack of a signature. The privacy and age screener started with a statement about it being important to have privacy, and if no, help them find privacy, or take time to find privacy, or change to another date where they might go find privacy. And because of the age imprecision in the registry system and the potential that age was not reported accurately by an informant, we ask everybody their age in year and month, and no one's interviewed if they're outside of the range 15 to 25. To ensure answers are securely stored, web surveys were administered directly from the University of Michigan Survey Research Center secure servers. Telephone interviews in Nepal also accessed the survey questionnaire on the same secure server. So even though respondents might answer on the phone, their answers were being recorded into the server at University of Michigan. And as soon as it's entered, it's secure there. And that approach ensures confidentiality and keeps those answers safe. I'm going to move to the contact protocol. Step one. It's a mixed mode contact protocol. You start by emailing an invitation to every respondent. The body of the email contained a unique survey link. If a respondent doesn't have an email address, we delivered a paper invitation with a QR code embedded. Each respondent receives multiple reminders through multiple modes: 2 or more reminders by email, 3 reminders by text message, and up to 2 phone call reminders to participate in the survey via web. So these are mixed mode reminders to participate via web. Finally, the instrument design, we drew on multiple sources, including all 5 of these: the Chitwan Valley Family Study individual interviews, the American Family Health Study, the FMELO study, World Mental Health Study, and RDSL study. Okay. All that was presented before. Now I'm going to new update stuff on data collection. So first thing I want to make sure everybody has a clear picture of is the methods and operations of the data collection. It's a sequential mixed mode data collection design, where first we attempt to complete the survey via the web with an interviewer administered phone option for respondents who do not complete the survey by the web. Then we use these multi-mode reminders I just mentioned, and the sample management system used by the interviewers in Nepal manages and tracks all of these contact attempts and whether or not a respondent has engaged in the survey. The sex and contraceptive use history calendar I'll describe to you later in this discussion. Features a mobile-friendly web-based format to collect monthly information for 2 years. And as I said, all data transferred. So I'm going to go down the list of the 10 steps for the initial baseline recruitment, and then show you how they worked over those 10 steps. First step is email to the 38% who had an email that CVFS had, and then a letter delivered invitation for the remaining 62%. Then an email reminder with the embedded survey link, another email reminder with the embedded survey link, then an SMS text message reminder, then a phone call reminder, step 5. You'll see that show in the data I show you next, then another text message reminder, then another email reminder, then a second phone call reminder, then another text message reminder, and finally we give up and switch to a computer-assisted telephone interview that's interviewer administered. This chart summarizes how cases came in during, and if you can see where I'm pointing, it starts out with 1, and you get a few right away, and then you get a few more, and actually even protocol steps that you think might not do much, do something. So you're getting some interviews added for every one of those protocol steps. 5 here is the first phone call reminder, and that's where you see the big bump up. And then again, you get a little bit for another phone reminder, a little bit at the last chance, and then the biggest single boost by switching to telephone. So the response rate in the baseline was 81.9%, or 2,999 completed at least a portion of the baseline survey. That's 2,999 15 to 25-year-olds. 58% completed the survey during the web phase, based on one of those reminders, and 42% completed the survey during the phone phase. The mean survey length was 14.5 minutes, just under our goal of keeping these interviews at 15 minutes or less. Okay, so that's a simple version. I'm going to switch to a little bit more complicated view. Sorry about that. These are this is results from a logistic regression predicting response using respondent characteristics that we knew before we interviewed them. Okay, so these are based on information in the registry system. And, you know, the first row shows that whether the respondent was male or female did not affect the odds of responding to the survey. Next, you'll see we had 2 age groups, 15 to 19, 20 to 25, and the younger age group was significantly more likely to respond than the older group. You'll also see that some of our respondents are outside of the country, outside of Nepal, and they were much less likely to respond. That result in particular should surprise no one. That is a big part of the issues faced in doing this kind of work. And finally, we knew their parents' ethnicity from the registry, and the reference group for this estimation is high caste Hindu, and you'll see differences that are not statistically significant except for the ethnic group Newar, who respond at about half the rate of high caste Hindus. And note that these effects are also independent of each other. So the outside Nepal thing might be correlated with age and Newar, but they're all in this model. Okay, with that idea of who answered the baseline questions, I'll proceed to talk about some of the baseline findings. I'm gonna give you some estimates of key demographic factors and key outcomes of interest. And then after that, I'm gonna assess the interview mode differences, adding phone interview to the web. How did that change baseline responses? So in the baseline survey, so I told you 2,999 participated in at least some portion. 2,985 answered all the questions. So among that 2,985, you'll see that 21% were teenagers, or excuse me, 15 to 17 minors, 42% were 18 to 21, and 37% were 22 to 25. You see that Educational attainments were much higher than our historical young adult CVFS data. So ninth grade or less was only 25% of the sample. 10th grade, including SLC or equivalent, 30% of the sample. IA or equivalent, 12 years or more, 36% of the sample, and BA, MA, PhD or equivalent, 7% of the sample. You also see that for these young adults, 39% are ever employed at baseline. Another group of characteristics, 38% were ever in a relationship of any kind. 16% were ever married. 27% reported that they had ever had premarital sex. And 13% reported that they were married but had never had sex. Note that that's you have to be both married and never had sex, so it's a smaller case base, but an interesting finding nevertheless. 25% used contraception, and 22% report having had sex in the last 24 months. That's important to us because we have this history calendar of monthly events that connects sex and contraception both. We'll show you that data collection format a little bit. And on the substance use side, we did measure multiple substances. Alcohol is the most commonly used substance by far. 24% report ever having used alcohol. 20% used alcohol in the last 12 months. And if you did use any substance, you're asked questions about that kind of go toward diagnosing there's a problem or not. And the first question there is, have you ever felt the need to cut down on your alcohol consumption? And 6% said yes in the last year, and 2% said yes, but not in the last year. Okay, now we're going to look a little bit deeper at the mixed mode method. How did adding phone mode change our estimates? Step 1, what predicts who used the web mode versus the phone mode? Step 2, and did adding a second mode add anything interesting? Step 3. So here in the first column, you see percentages of each of these things, 12 or more years of education, ever married, ever worked, ever consumed alcohol, ever had contraception, ever had sex, or ever had premarital sex. Those are the percentages who answered that question yes in the web survey. And then you see how the percentage changes when we add answers from the phone survey, okay? So adding the phone mode actually reduced the percentage with 12 or more years of education. Adding the phone mode increased the percentage who said they were ever married. Adding the phone mode made no significant changes to the percentage who said they'd ever worked, the percentage who said they ever had alcohol, or the percentage who said they ever used contraception. However, adding the phone mode increased the percentage who said they ever had sex and increased the percentage who said they ever had premarital sex. Okay, this is a little bit different look. This is more complicated. Here we have a logistic regression predicting the odds of mode choice, where the outcome is coded equal to 1 if respondent chose the web and equal to 0 if they chose the phone. I'm going to start first with the left column, where we have base demographics, things we knew before we interviewed them. Again, we see gender had no significant association with mode. Age, young age increased use of the web mode. Outside Nepal decreased use of the web mode. And delete ethnicity decreased the use of the web mode relative to Hindu ethnicity. Notice the other ethnic groups are also a little bit lower than high caste Hindu, but not significantly so. Okay, step 2, I'm going to add a few things that we learned during the interview. They have 10 or more years of education, they ever work for pay, and were they ever married. You see that 10 or more years of education increases use of the web mode. Ever married reduces use of the web mode. And together, those changes actually remove the significant difference by age group and the significant difference by ethnicity. Both could be explained by this compositional difference in education and marriage. The outside Nepal effect not explained that way. Last but not least, curious question, did the mode associate in an interesting way with some of our core and most sensitive outcomes? These are also logistic regression estimates of the effect of web mode, where web is coded 1 and phone is coded 0. And they control for gender, age, outside Nepal, and ethnicity. And you'll see in our estimate of alcohol use and contraceptive use, we see no observed mode effect. But in our estimate of premarital sex, we see that web mode actually reduces the percentage who report or the odds of reporting premarital sex. Super interesting because it's complicated, right? We know that that people who lived outside of Nepal were more likely to use phone mode, and we know that that may intersect with these two estimates. Next estimate is a huge odds ratio linking web mode with reporting that you're ever married and ever had sex. We know that being ever married was associated with mode choice again. So that drives some of what's going on here. These two are pretty interesting associations where at the very least, if you're studying these things, you want to take the mode and the process related to mode into account when you're studying the thing. Okay. Next step is to talk about our longitudinal follow-up findings. So one great thing about this design is we got much better contact information for the follow-up interviews than we had for the baseline interview. We used those first interviews to get recontact information. Email addresses went up from 38 to 48%. Phone numbers went up from 59 to 90%, giving us phone numbers. And having both, that is giving us both an email and a phone number, went up from 35 to 46%. So as expected, the respondents who completed baseline have more complete contact information, but we're also able to improve rates by explicitly asking respondents to update info at the end of this survey. Next, I want to talk about reducing the attrition across rounds of the longitudinal study by offering mode switching at every interview. The young adult study allows respondents to choose either web or phone every time. For more about this design, you can see a couple papers. I have the references at the end, so if you need to look them up, you can look them up later. These slides will be posted to the website. However, let's take a moment to consume this one. The right and the rows identify the baseline mode. The columns identify the follow-up mode being in phone and the follow-up mode being in web. And we highlighted two yellow boxes here to make super interesting and important points. Number one, if they answered by phone mode at the baseline, a whole bunch of people switched to the web mode in the follow-up. That is, it switched so that 44.7% who answered phone in the baseline actually switched to web. Second, the switching did not happen as much the other direction. That is, only 27% of the people who answered by web at the baseline switched mode to the follow-up to phone. Instead, most of them stuck with web, with 73% sticking with that. This combination of factors, of course, drives more responses to the web. You see at the top that we completed 2,848 interviews for a response rate in the first follow-up of 96.2% of those who completed the baseline, which of course we were happy with. At this point, the young adult panel has completed 5 waves of data collection. Actually, we're currently in the field with wave 6. We use a replicate design, and the first replicate is completed, but the second replicate won't be completed until the end of February. We're currently over 90% retention of these young adults across that time in both replicate 1 and replicate 2. And here we're going to show you a few results document changes between wave 1 and wave 5. So not all the way to wave 6 because it's not out of the field yet, but just to wave 5. Give you a sense of when they occurred. Baseline happened between September of 2021 and just a couple days into January of 2022. Wave 2 happened March of 22 through May of 22. Wave 3 happens June of 22 through September of 22. Wave 4 happens November of 22 through February 23. May 5 happens May 23 through July 23. And wave 6 is November 23 through February of 24. So we're covering about 2 years. And I want to get this just right. We wanted to show you this so you can see how evenly the spread of cases completed are across the interval between waves. So we get these intervals, and we create this distribution by using a design that starts the wave 2 first follow-up with responses assigned to staggered releases based on the completion date of their last survey. So you can see the peak here is really between like 132 and 172 days in that narrow area. There's some tails on this distribution, but that is by design. So we're going to keep using these replicate assignments to keep the duration between interviews as similar as possible, even though some people will have completed the prior interview much earlier in time than the follow-up interview. So this is just an example of the first interval, but I wanted you to see how consistent this is. Okay, so baseline to fourth follow-up is another way of saying from wave 1 to wave 5, okay? So ever married at baseline, 16%, ever married by wave 5, 23%. Not a huge jump up, but consistent with the young age group that we're in here, 15 to 25 at baseline. Ever had sex, by contrast, baseline 26%, by wave 5, 44%. Ever used alcohol at baseline, 24%, by the 5th wave, 34%. Ever used marijuana? I just want to give you a sense here, at baseline, 5%, by wave 5, 7%. As I said, alcohol, much more common. We measured some other stuff too. Marijuana is here because it's the second most common. Ever used contraception? At baseline, 24%, by wave 5, 44%. Okay. I'm going to take just a second to look at people's faces. And I do this in part in case anybody wants to ask a question about what I just showed before we go on. I'll take questions at the end, but I'm just checking in. Nobody going. Okay. So I will move on to the next steps with this study. Will I move on? Let's see. Yes. We have 3 big steps that the project is committed to in the next year and a half. One of those steps is to use the sex and contraceptive use history calendar measures. Those I'll tell you a little bit more about shortly. Another step is merging the calendars across the 6 rounds of panel data collection. And that's cool because it creates a continuous history across time, no matter when people were interviewed. And finally, linking back to all other CVFS household, parent, and early childhood health data. I think Emily Treleaven's going to talk about data linking to CVFS in the next webinar, but we'll do some of this. There's so much to do, as those of you who use these data know, that we will not do all of it in the next year and a half. So the sex history calendar, which I did talk about in 22, back in February 2 years ago, it launched with this baseline that had 24 months of retrospective, and if people had had sex kind of at all ever, and then month by month, and then we repeat that and link it across waves. So I just wanted to remind you what this thing looks like. This is an English version of the calendar, which is optimized for smartphone or computer, and the person can choose any months which ones they had sexual intercourse. This shows you the Nepalese version of that same page. This shows you what it would look like if they marked some of the months as they had sexual intercourse in those months. Next, we go to a contraceptive history calendar, and it starts out with some questions about all the different methods that somebody might have used, and we tried to be relatively comprehensive here in all the methods that our respondent could comment on. And then we go method by method, asking them to complete the calendar, and again we do this across waves so they could be linked. So here is what it would look like if on the answer about birth control pills. Again, they'd have to answer a separate set on let's say condoms or Depo-Provera or whatever, and that just shows them marked, and then with the check marks. And then pregnant, we also ask, and that shows what that would look like. And the shaded in all of these, I point out that the shaded shows you months they mentioned having sexual intercourse to help remember, then contraceptive use. Same thing with pregnancy. Okay, so that's the way that tool works. Okay, as you might guess, lots and lots of people had to work together to make this happen. We have a team of investigators on the NICHD R01 that supported this work. Includes me and my co-PI, MPI, Kate Scott, Ronnie Bruforts from KU Leuven, Stephanie Shardul, Heather Gatney, Deirdre Gamiri, Brady West, and Aaron Ware, all from here at U of M. We have a large group of survey operations team. This was a complex task to program both the instrument and the systems around it that keep track of which reminders have been sent, who's already answered, and keeps all the recontact information, updates that stuff. Gina Chung, Sarah Brauman, Hui Chun Peng, Carl Dinkelman, Jenny Williams, Cheng Zhu, and Peter Sparks. Really fortunate to have that whole team. And of course, the ISERN team who worked on this is so vast that I went with a picture rather than the full list of names. And you can imagine delivering letters, keeping track of what we've heard back from respondents, doing phone interviews, doing text messages, all that kind of stuff done through the ISERN. And happy to report I got to be in the building in December, and a lot of these people are still working, and a lot of this stuff still going on, and it's great. I put some references here in case they're useful to you. Like I said, we put these slides up on the website so you can get them easily there then. We wanted to mention the steps going on for data archiving of these data. The final questionnaires used in the field are available now on our website, and we're happy to send them to you. The data will be available through the University Consortium for Political and Social Research, as most of our data are. We're working on getting that finalized for baseline. As those of you who've done this before know, it's a process. Okay, I will officially stop talking and discuss whatever you like.
There's a question in the chat, Bill.
Aha, pretty good. I see it. Sarah, hey, thank you for attending, Sarah. What counts as in the household? In or out of the household?
Yeah, I guess like the sort of conceptual question behind that is like, is this like sort of kids who have been in the CVFS household, like when they reach adolescence, no matter where they are, or is it like the kids who are in those households at the time that you're doing the sampling?
No, wherever they are. Okay. That's part of the reason that the response rate's not perfect, Sarah. Yeah. No, I think we would have done a lot better if they were all sitting around Chitwan. I mean, we might have delivered 100% for you. I don't know, but and married daughters, a great example. Sons who are in Qatar, another good example. Wherever they are is the idea, and we would have used whatever information we could get to get phone numbers to overcome the difficulty. But that's one reason why the web survey on round one did not work as well as we had hoped, planned, aspired, maybe is the right word, is because they were all over the place. Once we were able to establish the phone contact with those who were not easy to find, then many of them did prefer to complete by web because it's easier for them too.
Yeah. And then, so then there's no like kids who come in, like girls who marry into the household aren't in the sample then.
If they were 15 to 25, Dr. Gamiri, I might need your help, or Heather, you might know this off the top of your head, picking the exact month of eligibility they would have had to hit. So Sarah, we defined a particular month of the household registry in which they would have had to be listed as a household member, even if they're away, and in the age range according to the parents, or I guess the household registry informant. Dirga, do you have that month at your fingertips? You're on mute, my friend, which is fine in general, but.
It varies sample by sample, so I can, yeah.
Well, there's two main months, but yeah, Sarah, they'd have to have met that criteria. So it is possible that somebody married in after the month of eligibility. To Dirga's point, we did, I don't know if there's more than 1 month on this thing, right, Heather? I don't know. You might know the eligibility criteria. There is a very specific eligibility criteria, which I could tell you if I remembered it. I'm sorry.
Are you talking about April 2021?
There
So
we
you
go.
had to be
Thank
in
you.
the household
I thought it was
registry.
something that specific. Yeah.
It
Or
is.
yeah,
April
even just like
2021.
conceptually, like it's, so it's not just the children of the original sample. It's sort of like children who are connected to those households through some complicated.
That's right.
As defined by the household on April 2021. Thanks, Heather. Yeah, that's the month I was looking for, because that then drove all the steps we needed to do to get it in the field by, what did I say, September 2021 was when we launched data collection. And we assigned to we did a random assignment to the 2 replicates at the baseline, so we could use their performance at baseline to make adjustments in the subsequent rounds. So there was like select the sample, get that randomly assigned to the 2 replicates, then launch the first replicate sequence there. Yeah, we intended not to exclude people, but we had to use a definition.
I've got a question.
Yeah,
Can you
please.
talk a little bit about like the measures that you used and why you picked, you know, contraception use or those kind of things? Yeah, like how you determined what you're going to use in the sample.
I would love to talk about that. First thing I'll tell you about that is we made a promise to ourselves to keep these interviews under 15 minutes. Emma, that automatically like makes this a nasty job because all of a sudden now you can't ask all things you might like to ask. You're forced to not ask a bunch of stuff. So that's the hardest part of the job, I'd say. We made that choice because prior work on re-interviewing people in frequent interview panels reveals that the longer you ask them questions for, the less they respond. A bunch of us here worked, for example, in the RDSL study in the United States, had the same core principles. Hey, if we're going to ask people every week in that case, or every couple weeks, let's keep it brief. And so that was a big issue for sure. In that context, at baseline, we asked more. At baseline, we did get this full 24-month history of sex and contraception. So I want to tell you where the sex and contraception focus was motivated. This is from a project funded by the National Institute of Child Health and Human Development Population Dynamics branch, focuses on intergenerational models of family formation outcomes, where family formation outcomes include marriage and childbearing, which are easier to measure in an open interview and discussion, but also include 2 key drivers of those processes: sex and contraception, which in most settings, but certainly in Nepal, are considered relatively private personal matters that aren't really appropriate to discuss in an open conversation. And so those key outcomes, we moved to this mode to improve complete reporting of sex and contraception. That forced us to make then all these adjustments about keeping it short and so forth. But in the baseline, we also asked history of work, education, some of that kind of stuff. And we also asked some attitudes, but then the way we handled that is, for example, there's a few people here who've worked with me before and know that my favorite attitude in the world is the Coombs scale of how many kids you want to have. The Coombs scale takes about 3 questions, and we asked it at baseline, but then we rotated it. We only asked it some of the time, I think every 4th one. And we worked on some attitudes about marriage timing and some attitudes about some other stuff, just so we'd have more than one set of attitudes measured. In the final round, round 6, these things that were either only asked at baseline, like your educational attainment as of that time or your work experience as of that time, were repeated in the closeout round 6. And the attitude items that we rotated through during the ones, and we asked them all in round 6. So round 6 will take a little bit more time than round 1 also. But then, yeah, so the intergenerational project that this is from, the key scientific contribution of that project is to focus on mental health of the parents. One of the great things about CVFS is that we have in general interviewed both husbands and wives using the exact same instrument. That's allowed people to make a variety of kind of contributions about how attitudes of, let's say, dad, I don't think Elise Jennings is with us today, but how attitudes of dad might work differently than attitudes of mom, or the same as attitudes of mom, and whether they're independent effects on the kid or not, that kind of thing. So we had an opportunity to do the same thing with mental health study. The mental health study I'm not talking about today because it's part of a separate project funded by NIMH. And there are some webinars about it if you want to hear more about the mental health project. But this stuff was an opportunity to look at how variability in the parental experience of mental disorders affects variability in the kid's experience of getting in or out of sexual relationships, consistent use of contraception, or getting married and having kids. So that drove a lot of our content decisions, and why we wind up measuring alcohol use, for example, in this study. Emma, there's a big terrain here. That didn't have to be a satisfying answer. If you'd like some follow-up, please let me know.
I do have one follow-up. I'm just curious if there was any question that you really wanted to ask that you weren't able to because you were kind of limited by the time.
Oh, 100 of them. I mean,
Fair enough.
and if you want the first list on my mind, look at the 2008 Chitwan Valley Family Study individual interview. I would have loved to repeat everything there. As you might guess, some of the students working here would have loved if I had done that too, because it would make a really cool, intergenerational dissertation type of thing. And there's no way we could do that. Those interviews took, Derek, I might get this wrong, but I think those interviews were in the range of 60 to 80 minutes. And we didn't think there's any way we could work by web or over the phone. So yeah, that would have been, anything from there would have been great, actually. I'm staring Lisa Pierce in the face, and I didn't even ask religiosity of these people. And for the record, Lisa, I'm kicking myself over it, because now you start looking at intergenerational stuff, and of course parental religiosity is relevant. So now you want to know, well, what's the kid's religiosity? And Emma, I don't have it. Bummer.
I don't want to hog the Q&A, but I have another question, which is about those responses of people who are married and never had sex. Can you talk, is that a real thing? Is that like people who are separated by migration? Is that people who marry early and wait to consummate? Like what's going on there?
I am so excited to get to work on that. We've presented these results a few times as and Dirk is chuckling because he's like, oh wait, that can't be real. One of my favorite times presenting it is Stephanie Shardul and I presented this to the ISERN staff in Nepal. We're like, okay, what about this? And they did a great job of exactly what Dr. Gamiri would want them to do, I would say, which is they listed off all the things they could think of that might be a mistake in what we did. Give an example. Did people just skip the question and you coded it this way? Did people say don't know and you coded it this way? And honestly, I did. When somebody says, I don't know if I had sex, I'm like, what the heck am I supposed to make out of that? So I did try coding that 2 ways, because I was like, what does that mean? But we came back and coded all that stuff to missing, and this result still holds up. And I came back from that experience because of this. I think it's I was going to call myself naive. I feel like I shouldn't call myself naive. I mean, I did live there a bunch, but I'm going to call myself naive because I'm definitely not in touch with what it's like to be 15 to 25 right now, and certainly not what it's like to be 15 to 25 in Nepal right now. So naive is fair. I think, there are 2 processes that I thought about. One is the labor migration. Absolutely. You get married, and it wasn't the product of dating and sex that you got married, then what actually happens if the person's got a job in another country next or something like that? I don't know the answer to that. Definitely an answerable question with the CVFS. The other one, which, Derek, I feel like you're not only the expert, I think you taught me this, was I have a woman who's not with us today, Emma Banchoff, who's a PhD student, and I would love for her to do some interviews with young women about this, because all I know is what guys tell me, and all I know is what guys told me 40 years ago or whatever, but this awkwardness that goes with arranged marriage. Like, okay, our parents picked us, and here we are, and we met for the first time at the wedding, and they might even send us off on a honeymoon. And I've had a couple, I don't know, Derek, probably something on the order of half a dozen guys admit to me that, oh my God, Bill, that first, they call it a honeymoon. I don't know what that means, because we get off the bus in this other town and go into this room where we're alone together for the first time in our lives. and look at each other going, I don't know what this means. So I don't know whether that's a plausible explanation, but we have, again, with CVFS, good measures. I guess I got some combination of Dirga and Coulter to thank for coming up with the measure of how involved were you in the choice of your spouse, which turns out to work differently for males and females on average, and which could be, you know, a little bit, a lot, completely, not at all. And then Coulter for pushing to get it into the registry system. So each new marriage, we do ask that question. So in theory, we could have a look at that one too. I suppose those are the hypotheses I got so far. Dirga, you've remained unmuted. Care to add any hypotheses? Where data error I put out there already. Okay, so if you choose to lead with that one, I'm going to say I already said that.
Yeah, I will not have other alternative argument hypothesis, but yeah, I would like to look at those data.
Well,
Yeah,
and
see
I'm also
how much participation in marriage would explain that, and see how that. Yeah,
I also am very excited, Sarah, to look at the forward part of that data that follow from baseline till now, which give us another 2 years of exposure with month-by-month data on, and we could put when they get married in there and see whether the sex happens premaritally or after marriage. We have a questions in each of these questionnaires that I used to show you that the percentage of people who report having premarital sex went up a lot higher than the percentage of people report getting married. And so that's possible because if you had sex and you've never been married, it still counts as premarital sex. Unfortunately, I got married, but I didn't have sex. You can only be exposed to the risk if you did get married. So we don't have tons of power, but I'm totally curious to look at how that looks going forward. And to see whether is it just a month or two? Is that what happened? Or is it 6 months or a year? I don't know. I see, Heather, we do have a couple questions. Anne asks, why would people be more likely to disclose sex and alcohol drug use over the phone rather than on the web? Thanks, Anne, for asking that. I think it's an awesome question. And I thought on the web would lead to higher disclosure of everything. There's two possibilities I want to point out. One that works for alcohol and drug use, which makes no difference. We see no evidence of any difference there. For sex, or in this case, premarital sex, we do see a difference, but we also know that people who are outside Nepal answered via the phone at much higher rates than people who are inside Nepal. So it's possible they're telling the truth either way, but people who are outside Nepal, who are almost all males or high proportion males, let's say that, it's not almost all because there's a bunch of people in school in India who would count here. But the people who are in the Gulf countries or places like that for just labor migration, predominantly males. And it could be just they had chances to have sex that people who stayed in Chitwan never had. Julie asked, could it be not knowledgeable of choice of wording a question? I doubt that. I moved to Nepal when I was 12. I learned some Nepalese from a language trainer in my first month and gave up quickly. But I assure you, within 6 months, I knew how to talk about sex in about 6 different Nepal languages. That turns out to be something that teenagers learn real fast, even at 13 and 14. But I don't know, Dirga, if you have any well, we use the mode to reduce the possibility that people would hide sex or alcohol and drug use from us. Now, I think phone worked just as well as web in many respects because no one gets to overhear the question being asked. We asked the respondents by phone to find privacy. Privacy was a criteria for conducting the interview. The respondent had to tell the interviewer that they had privacy and it was okay. But even so, you'd be hard to overhear what the question was when the respondent says yes. I'm going down questions. Different Sarah, thank you. When constructing the EverX outcomes at wave 5, do you pull in responses where able from the prior survey rounds? So by wave 5 would include any mention between baseline and wave 5. So if baseline's wave 1, that includes wave 2, wave 3, wave 4, and wave 5. Answering yes to any of those equals answered yes by wave 5. And Julie, for PSID, we ask about sexual intercourse and have they had children or ever had sex, mostly here in the States. Yeah, and actually, I've done a bit of work with the PSID transition to adulthood supplement measures of sex compared to the NSFG measures of sex. Heather Gatney, thank you for your help with that. And I will note that in a national survey of family growth type of context where the whole thing's about the reproductive health, you can get a little bit better reporting of sex. And I'll say I have a paper on forced intercourse that shows higher reporting for the same time periods in the NSFG than in the PSID. And I think that's one reason that the context of the PSID is a lot of different subject matter. The context of an interview that's just about reproductive health, you spend a lot of time talking about a lot of things related to sex by the time you get asked questions like that. Heather, I note I'm almost out of time.
Real quick, I'll ask, I may have missed it, but is it similar to the RDSL in when you're asking questions about sex, are you also tracking relationship, like in and out of, are they in a relationship or not, and same or different partners? Just curious.
Yeah, it's not like that in this sense, Lisa. RDSL had the advantage of doing an interview weekly and so could ask that particular thing weekly. We get monthly data on sex, contraceptive use, and pregnancy by getting it retrospectively between rounds. We do know if they got married across rounds, which are anywhere from 3 to 6 months apart would be the maximum range, I guess, on that. So it's not as smooth as RDSL would be on the partner topic. Rates of these things are probably lower than RDSL also.
All right, it's 3 o'clock. Thank you, Bill.
Thank you.
My pleasure. Thank you so much
Thank you
for
for
joining us, asking questions, the whole thing. Really appreciate it. Great to see you.